Good morning.
Hundreds of Louisville College students filled the floor of the Kentucky Center for African American Heritage. They're future doctors, nurses, dentists, public health employees, pharmacists, and social workers, here for the Culturally Effective Care Symposium.
This is our 13th year of doing this, and the whole purpose is to bring awareness to culturally effective care. So with all the change in the demographics and the change in our patient populations, we want to make sure that our professional students are equipped to be able to provide the most comprehensive, culturally effective care possible.
UofL and its partners at Passport Health Plan are sponsoring the training.
LGB identity. So estimates vary between 2 and 4%.
Which focuses on getting these UofL and Sullivan students comfortable talking with patients from diverse races, cultures, or sexual orientations.
It's really important that they're setting the tone really early on in our careers, that we're going to be treating all types of patients, and that we need to learn how to respect them as they come in as whole individuals and their identities.
Especially in women's health, primary care, having conversations about, what are your experiences, not just sexual identity or sexual orientation, gender identities, things like that, but really with any sort of cultural background, anything that's vital to you as a patient, that should be important to us as healthcare providers.
The workshops push the students to recognize their own biases and stereotypes and work past them.
It's really teaching me to see things from a perspective that's different from my own, because whenever I try to think about cultures, I usually go from what I've experienced in my life, but now I'm getting to put myself in other people's shoes and go think about what they've experienced, and maybe be a little bit more open-minded when I'm practicing medicine later on down the line.
That's what future patients and UofL professors want to hear.
We as UofL, we are a leader in talking about disparities, in diversity and inclusion, and this is part of that overall picture of what we want to be known for, is making sure that we're addressing issues across the board in all populations, so that everybody will feel included in that and have equity in health care.